Hi, I am Ramesha Karnasena from Singapore Management University, and our paper is titled Measuring Data Collection Diligence for Community Healthcare. We have partnered with Google Research and Kushi Baby, which is an NGO based in India. In the spirit of collaboration, the problem being solved here will be introduced by Rajit Nagar, the CEO of Kushi Baby.
Thank you, Ramesha. I'm Ruchit Nagar, CEO of Kushi Baby. We provide digital health solutions to the Department of Health in Rajasthan, India. Since 2014, we have been working with auxiliary nurse midwives, known as ANMs, and other community health workers, building digital health solutions to empower their delivery of last mile healthcare. In the last mile setting, we have beneficiaries that have to walk through tough conditions in order to get to makeshift health camps. And we have health workers that are going through equally tough conditions and mostly tracking data on paper. And this scenario, unfortunately, does not allow us to glean insights from the important preventative care that is being delivered in these settings. This data is incredibly valuable. It's valuable for public policy decision making at a state level. It's important for risk stratifying entire communities and even ensuring the longitudinal care of a given patient. But due to various different factors, whether it's lack of supervision, lack of human resources or training, and the improper incentive structures, the data quality that's being collected, even now on digital systems, is far from ideal. And we are looking to improve upon that data quality because these challenges have prevented us from doing things like modeling out which mother is highest risk and what that effect could be on her future child. Ultimately, what we need a way to measure non-diligence in data collection. We need a way to predict what that non-diligence will be and explain in what ways the health worker is being non-diligent. So that way we can design targeted interventions. We have 15 community health monitors that have been supporting these health workers over the last 4 years. And we do have a general gestalt or idea of which health workers are good or bad. But with data, we can turn that conception into something far more specific and then therefore take data-driven engagements to improve data quality and ultimately health outcomes. To tell you how we're going about doing this, I'll pass it back over to Ramesha.
Thank you, Rajit. Let's have a look at our problem description. This can be divided into 3 problems. First is how to quantitatively measure non-diligence per ANM. Here, by non-diligence, we mean the poor data collection quality. The second problem is how to predict non-diligence per ANM to enable intervention. And the last problem is how to explain the behavior of ANM over time. Let me minimize my video since it's covering part of the presentation. There are a few challenges in this problem. The diligence of an ANM is not expected to be of the same quality over time, which brings in a temporal aspect to the problem. And we do not have any labels on who are the diligent and non-diligent ANMs in each time frame. Given the very hard unlabeled setting, we need domain expertise. Kushi Baby provided us 11 rules designed by domain experts with years of experience. All these rules measure some percentages, and these rules were used with fixed thresholds in the past. For an example, the blood pressure rule measures the percentage of blood pressure readings by an ANM that are equal in a month. In this example with 5 patients, 80% of the readings are 120 by 80. When these rules are naively used with fixed thresholds, no ANM was tagged as non-diligent if they are used in N manner, and all the ANMs were tagged as non-diligent when they are used in O manner. We used a threefold approach in this study. The first is defining non-diligence behavior, and the second is defining non-diligence score and predicting the non-diligence score to rank the ANMs, and the third is cluster and generate interpretations. First, let's look at how to define non-diligence. We use all the data of ANMs in a time window of 1 month, and we process the rules using those data. Earlier, we explained the BP rule, and for all 66 ANMs, we have the percentages from the BP rule. Likewise, for each ANM, we have the percentages from all 11 rules, which gives an 11-dimensional vector. We call this as a percentage vector. We need to convert the non-diligence percentages to non-diligence probabilities. We get all the percentage vectors of all the NMs in all the months and plot the distribution of percentages for each of these 11 rules. For an example, this shows the distribution of BP rule percentages. Here 0 means good performance and 100 means bad performance. Suppose an ANM got 80% for the BP rule. To find the non-diligence probability, we can take the probability mass left of the 80 in this plot, which is 0.9. Likewise, we can get the non-diligence probabilities of all the ANMs for the BP rule. So for each ANM, using the 11 rules, we get an 11-dimensional probability vector. We call this as the behavior vector. This gives a relative measure of the ANM's non-diligence with respect to the past performance of all ANMs in each rule. But this 11-dimensional behavior vector cannot be used to rank the ANMs. Therefore, in our second approach, we define a scalar non-diligence score using the Euclidean norm of the behavior vector. The ideal behavior vector for an ANM is the 0 vector, meaning 0 probability of non-diligence for every rule. Then we predict these scalar non-diligence scores using the ANM's past scalar scores in a linear regression predictor. We observe that given limited data size, linear regression outperforms other complex models such as neural networks and agrees more with the field monitors. The ranking enabled by these scalar scores will allow for intervention using limited resources in future. The figures show the distribution of true scores and predicted scores of the ANMs for 2 months in the test dataset. Given the real-world noisiness of the problem, this result was found to be acceptable by Cushy Baby. Now let's look into our third approach on how to cluster and generate interpretations. We cluster all percentage vectors obtained over all ANNs for every month, and we get 3 clusters. We convert these 3 cluster centers to non-diligence probabilities. We use this and the standard deviation of percentages to generate interpretations. We interpret the clusters in 3 varying information levels to match the different perceptive skills of the stakeholders. And this provides an idea about the type of non-diligence shown by the ANMs in hindsight. I will only describe the fine-grained interpretation in this presentation, and for coarse interpretation levels, please feel free to refer our paper. After clustering the percentage vectors, we get the non-diligence probabilities of the cluster centers. This shows us with respect to which rules the ANMs in each cluster is being non-diligent. However, some rules are important than others. For an example, for the BP rule, we observe more variance in the distribution of percentages. This means there is more room for improvement for some ANMs here. So we provide the interpretation for each cluster with respect to the important rules like BP rule. But for the rules where there is no significant difference in the performance for all lane names over all the months, we do not provide any interpretations. However, we note down these rules for Cushy Baby to investigate. Note that we use the percentage vectors and not the behavior vectors because we want to measure the absolute performance of the NMs and not the relative performance. Now we have described all three approaches, and then let's move on to the main highlight of our study, which is the field test. We validated our results using the observations made in a highly structured field monitoring exercise carried out by Cushy Baby in Rajasthan. The field monitors worked with randomly chosen ANMs for 1 week each, and the whole exercise was carried out for 4 weeks. The monitors were provided a list of questions relating to the ANM's performance, and Cushy Baby inferred whether an ANM is diligent in a week based on the answer to this question, which is what we compare with the output of our AI system. We observed 84% correct non-diligence detection by our system, where 67% of our AI predictions matched with the monitor's observations, and in the remaining 17%, our system correctly identified non-diligence, which the monitors missed out. As ethical considerations, we use the word non-diligence to emphasize this is not a deliberate manipulation of data by the ANMs. And we sought regular feedback from the field monitors throughout our project. The targeted intervention based on our system's results will be non-punitive. Many of the data quality related approaches in the literature focus on scenarios where the noise or corruption is an outlier. But poor quality data is not an anomaly in our problem. In fact, majority of the data is poor quality due to the non-diligence in collecting data. We tried a popular variational autoencoder-based anomaly detector, and the percentage of ANMs tagged as non-diligent is around 10 to 12%, which is considered as too small by Cushy Baby. To summarize, our final product has been through many iterations before the success in this final system, where we learned many lessons from our experience, and I will list down few here. It is important to get constant feedback from the ground throughout the project. Our initial product had the binary output of diligent or non-diligent, but the field team required a fine-grained scope, and now we provide that. Also, our system had 3 additional rules which capture records of health tests which are done at the main health centers only. After an ethical review, it was decided that these rules do not capture the ANM's diligence. Second lesson is that the black box interpretations, that is explaining by providing quantitative weights of the rules, were not useful for the Cushy Baby's field team in our case. Hence, now we provide fine-grained cluster interpretations, which is much more preferred by the field team. For real-world applications, it is important to use techniques that are relevant for the problem. Initially, we used the LSTM network and fuzzy clustering. And although the system had high accuracy, this was not convincing or interpretable for the field monitors. Last but not the least, when solving a real-world problem, we have to be ready for the environment to change. So we have a flexible system where rules can be modified, added, or removed easily. Finally, we are currently developing stillbirth and low birth rate predictors using diligence scores as an indicator of the data quality. This data quality problem can be observed in all the states of India. And we hope to apply this technique to other areas of India as our NGO partner Kushi Baby expands their operations. Thank you for listening to the presentation, and if you have any questions, please feel free to email us. Thank you.